Welcome back. Today's topic type 3 hypersensitivity. What we know about it already, it is immediate hypersensitivity. It is humoral mediated. IgG and IgM are the main hero. Mainly IgG is predominant, but you don't require only antibody, you require antigen antibody complex. So it is also known as immune complex mediated hypersensitivity. Okay. So what happens here? So let us focus on this diagram. So first of all, whenever antigen comes to the body, it gets phagocytosed by APC, presented to CD4 T cell. CD4 T cell will get activated and also activate B cell. B cell converted to plasma cell, form antibody. This antibody will go and bind to this antigen. So story so far is very clear. Now, once we have this antigen antibody complex, also known as immune complex, now what happens? So, initially, uh, the excess of antibody is there. Okay, excess formation of this immune complexes are there. So, this immune complex they get deposited on various tissues as well as vessel walls. Okay, and under normal circumstances, these immune complexes get rapidly cleared by complement system. Okay, and but what happens is that in this case, there are two mechanisms which are at play. Okay, the complement will bind to this bound antibodies FC site, which is free, and cause complement mediated lysis and inflammation. Similarly, macrophages and other cells also bind to this FC portion using FC receptor, and they also release some cytokines and enzymes and other reactive oxygen molecule, and they will damage the tissues which are around that immune complex. Okay, so but why this happens now? Okay, so for that we have to understand the concept of equivalence. So usually the larger immunocomplex, which are easy to recognized by immune cells for clearance or get phagocytosed, you require antigen and antibody in almost equal proportion. Whenever in initial stage these immune complexes which are formed, they are very small. Why? Because we have too many antigens and too less antibodies, so there is antigen excess phenomena. Okay, and this antigen excess phenomena makes them soluble, but once they reach to the various vessel sites and get deposited because they are small in size, but now we have started making antibodies, so more and more antibodies they get deposited there and make it insoluble, and these insoluble complexes will picked up by phagocytes, and they are phagocytosed and destroyed. So spontaneously this hypersensitivity get cleared or resolves. Okay, but in early situation where antigen excess is there and these small immune complexes which has traveled through blood and deposited in various sites, during that portion, if complement mediated lysis is there or fc receptor mediated uh, inflammatory reactions are produced by immune cells, then you have type 3 hypersensitivity. If this reaction is localized, we call it as Arthus reaction. And Arthus reaction is basically you have localized area of tissue necrosis due to this vascular inflammation or vasculitis due to this immunocomplex. For example, you can see them in skin following insect bites, or sometimes during allergic desensitization treatment also, where we give repeated injection of same antigen for a long period of time. In lungs also, for example, farmer's lung, which develops following inhalations of actinomycet species, which is from moldy hay. Saccharopolyspora species is responsible. Bird fanciers disease, where inhalation of serum protein in dust derived from dried pigeon species. So these are a classical example of localized type 3 hypersensitivity. If it is a generalized thing, okay, it is happening everywhere, it is a systemic reaction, then we call it as serum sickness. Okay, And the classical thing is that it is not seen nowadays. It was earlier seen where we were giving serum, patient serum therapy. Uh, so administration of other human beings serum is given to the patient for treatment. For example, horse anti-tetanus serum. Okay, and because horse serum proteins are foreign, they will induce antibody in the host, and they will have this hypersensitivity reaction. But as I already told you, it will be there in early phase. Later on, as immune complex start to get bigger, they are getting removed by complement and phagocytes, and instead of causing local damage there, so it will resolves after a few days. So that is serum sickness. So now that is not very common because we are not using uh, those things. Uh, so Arthus reaction is usually common. Okay. The other classical examples of type 3 is connective tissue disorders like systemic lupus erythematosus, where anti-DNA antibody plays a role. Rheumatoid arthritis, where you have antibody against human immunoglobulin. Polyarthritis nodosa. So such collagen vascular diseases, some parasitic infections, for example, Plasmodium malariae, in which nephrotic syndrome is seen, schistosomiasis, having Katayama fever, or African trypanosomiasis. Some bacterial infections like Streptococcus pyogenes. After that, you have post-streptococcal glomerulonephritis, where the child develops hematuria but spontaneously resolves because it is type 3 hypersensitivity. Mycobacterium leprae, you have lepra reaction type 2. You can check out our videos on leprosy for that. Then viral diseases like hepatitis B, C, or Epstein-Barr virus infection causing infectious mononucleosis. Arthritis, especially in dengue infection or hepatitis B or C, that is a classical example of type 3 hypersensitivity. Hyperacute graft rejection, subacute bacterial endocarditis, serum sickness. These are very common examples of type 3 hypersensitivity. So let us again uh, summarize the entire thing. What happens is that initially, when antigen comes into the body, it stimulates B cells to form antibodies. But initially, the number of antibodies are less and antigen is in excess. So whatever immune complexes are formed, they are very small, and because they are small, they are soluble. They enter into the circulation and they get deposited in various vessel walls. And then because antibodies attached to antigen and they are attached to the our cells, the complement as well as the other immune cells like phagocytes and NK cells, they decide that okay, this is we have to destroy this, so they attach to its Fc portion and exert inflammatory actions. So that damages that antigen also, as well as the vascular tissue to which they are attached to. But later on, our immune system will produce more and more antibody. That antibody will go at that site, and this immune complex start to get bigger and bigger, and now they are easy to phagocytosed, and they are easily recognizable by our phagocytes, so they are easily cleared up by our body, and that's how this hypersensitivity will resolve out. This is the only hypersensitivity for which second exposure is not required. Only with one time exposure you get this hypersensitivity. So that is to be kept in mind. So thank you for listening to this video for type 4 hypersensitivity. Stay tuned to the channel and watch our next video.